Thank you for joining us today. My name is Tim Thomas, and I'm the Vice President of our Cardiovascular Medical Informatics business. A few housekeeping items before we get started. This is our first webinar in a series that will focus on new technology, as well as customer and client provided topics. We will be recording today's presentation, and we will make it available via the email address you registered with. Today's presentation will run about 30 minutes, and then we'll have time for questions. At the bottom of your screen, you'll see a Q&A button to submit your questions. Please feel free to submit these questions at any time, and we will answer them at the end of the presentation. Let's get started. This is an exciting time for us, as today we're announcing the integration of new key technologies that will enhance our offering for our customers, providers, and patients. Adam Hooker, our National Manager of Technical Sales, will cover our AI framework and emerging areas in technology related to automated view identification, automated measurements, and clinical disease detection. Today with us, we also have Crystal Lowry, Clinical Solutions Success Manager from Ultromics, and she will be highlighting one of the great clinical disease detection offerings from Ultromics for HFpEF, all accessible without launching into another application, seamlessly integrated into your Synapse workflow. With that, I'll hand things over to Adam.
All right, thank you, Tim. So as Tim mentioned today, we are excited to discuss with you how FUJIFILM is utilizing artificial intelligence to transform cardiology. When you look at this FUJIFILM portfolio, one of the things we're certainly excited about is our enterprise applications that we have offering in many different important departments within the hospital. As far as, we have our radiology and cardiology solution, both on our Synapse PACS, server-side rendering application. We have our digital pathology and enterprise viewer. These do offer certainly the excitement of our server side for the radiology and cardiology, and as well as the ability where it integrates with our Riley AI platform, which allows us to utilize these different vendors and their algorithms and within your workflows within the two ologies. When we really focus on what Synapse AI platform can offer, it really goes around its efficiency and easy to use. Given that it's an open platform, it allows us to integrate into existing workflows in viewer. It eliminates the requirements that you have to support multiple different AI vendor applications separately on your workstation. Instead, what we're working to do is have those being standardized within the platform itself. What's nice about this platform is it also supports some key features, such as being able to pre-read the studies and look to start identifying those areas of interest. And then we can use that information to begin to triage the study ahead of the time that the cardiologist or radiologist is ready to read it. This is something not new for FUJIFILM and the AI. We've been doing it for many years now, and certainly in the radiology. Some folks on this webinar may be familiar with those offerings today, where we have already vendors integrated into the AI platform with our lung nodules and intracerebral hemorrhages. However, this is something newer for cardiology, and certainly there's a lot of excitement coming around that through our webinar today. As I mentioned earlier, by integrating multiple vendors within this application, it also allows us to apply multiple algorithms on the same procedure. So I don't necessarily have to use one vendor for a particular read for my echoes. I can utilize the best in breed across the platform and apply all of that information and help me diagnose the patient. With this platform, we not only support older technologies that have been around for years that we're all used to, such as DICOM secondary capture or GSPS objects, but we're looking to also integrate with newer ones with web service APIs or HL7. All of this information can now be integrated into Synapse directly through our AI platform. So we wanted to provide an example of what this could look like, with our AI platform. Here we have an example where the modality has sent over the study to Synapse PACS, and Synapse PACS has now taken those images and forwarded them onto the AI engine. Maybe that's on the prem, maybe that's in the cloud, but that's the beauty of the platform. It does, from our perspective, we're open to either option. Once that engine is done and has its findings, that information is then passed on to the AI platform, which is in constant communication with our PACS, which we then are able to provide that information down to the local workstation and within the web application for Synapse PACS. From there, now the user has all their AI findings right within Synapse and available to assist them with the diagnosis. So when we look at how does this apply for cardiology, really we look at some of the thought leaders, within the cardiology and certainly the echo world, such as, Dr. Roberto Lang and Dr. Partho Sengupta with their recent comments they had, with ASC here in 2023, where they were asked about, AI specifically in cardiology, what is their advice to folks, considering that? Dr. Lang really summarized it, I think, well, where he said, echo labs that do not have AI, will fall behind. And Dr. Sengupta, further enhanced that by saying that, with these applications in echo, really the idea here is to really enhance, your workflow and make sure that you can use these AI algorithms to take care of a lot of the easier work and provide more time for users now to do more of the high caliber activity. At the end of the day, that's really what we're looking to do as we evaluate all of our AI vendors, is try to find ones that can help, assist sonographers and assist cardiologists so that they can spend more time diagnosing the patient, really working on that complex case and spending more time with their patients. With FUJIFILM and our goal of providing these AI algorithms to our cardiology customers, we really want to make sure that we are providing you a solution that provides and improves your accuracy, your precision, as well as your processing times. Today, we want to highlight 3 different areas that we're focusing on with cardiology, with our partners such as Ultromics, and how we're bringing those to our product line. The first one's really going to be in the view identification. Through our integration with Ultromics, we're able to utilize their automated view classification tool and be able to integrate that into the workflow for echoes. As we all know, with the cardiovascular modalities, we often don't see those labels being applied to the images of what type of view was performed on the ultrasound. So that does now lead that a lot of the image order is going to be solely based on the acquisition time. And with a lot of these procedures, they may not always be in the same order every single case, such as if they can't find the perfect view and they get a suboptimal image that they're kind of working through, or maybe the patient's pathology presents itself in a way that they want to take additional images. Our goal is to be able to utilize these views and help avoid users from having to, we'll call it, jump around and look for the specific views they're wanting to find and make it more streamlined for them. With this automated view identification through Ultromics and integrated into your workflow for cardiology, we're now able to take advantage of things like reading protocols. Radiology's been doing it for years, right? And now we're trying to make sure that we're applying that to cardiology and helping streamline your view so that I'm not only can able to apply that to current, but as well as prior procedures. So if I want to go in there and I want to select in my reading protocol step, give me all of the images associated with the mitral valve, for example, now it'll automatically find those and arrange those for me and allow me to quickly see that. And I can do the same with my prior, really helping streamline that workflow for cardiologists. The next area we want to focus on is automated measurements. When we look at this, we know that, according to ASC on average, sonographers are going to perform about 8 echoes a day. 45 minutes to 60 minutes of that is probably going to be for those those non-complicated or uncomplicated transthoracic cases. And sometimes if they get into really complex anatomy or a case, maybe it's another 15 to 30 minutes. So there's a lot of time potentially, with that scanning, making sure they get all of the images they need. What we're looking to do is help now apply this automated measurement through a lot of our partners and be able to utilize some of the change we've seen in the pay models and is being discussed as well, where maybe it's not necessarily based on the volumes you're doing, but more based on the outcome or value based. So our goal is to be able to utilize these AI generated measurements and work to decrease the variability so that we can increase the outcome base and the quality, the quality of the images. And now you're looking at a more significant and stronger correlation to these findings based on manual reads. Through our partnerships, we are working to develop these integrations today, where we're not only working to import the measurements and the values or just maybe presentation stage, but we're wanting to take it one step further. We're working to make sure that those measurements that are performed by the AI is now being imported as the coordinates. As you'll see here in this example, the idea here is by importing the coordinates, now if there's maybe a slight disagreement by the cardiologist, they were able to update that accordingly, not necessarily having to redraw the measurement itself. And finally, the last thing we want to talk about from what we're working on in FUJIFILM is our ability to detect clinical disease. Certainly the most important one we're wanting to highlight today is again, with our integration with Ultromics and their ability to identify heart failure with preserved ejection fraction through their EchoGo application. As you remember earlier, we had that diagram where it talked about how we can route those images automatically to Ultromics and begin that analysis. And that's the goal with this clinical disease detection that we're working to integrate. By being able to have that information already sent to Ultromics, now we can have that application begin to do their processing and be able to send back to us a diagnostic report based on the findings. Sure, we can just stop at potentially importing a DICOM secondary capture of the report and data, but we want to take it a next step. We want to make sure that we're, again, enhancing your workflow and providing that ease of use through the AI platform. And that's really where that Synapse AI platform is going to come in. By being able to utilize our triage functionality, we're going to use that information and begin to move that patient up on the list of your work list if heart failure is detected. We're also going to provide the users a notification card within the work list. And now it's going to give them a preliminary idea of why we did triage this study higher up in their work list, since it is more of a time-sensitive finding. So as you can see, we're certainly excited about what FUJIFILM is doing and partnering with our AI vendors to help revolutionize cardiac care and how it can play a role in improving accuracy, precision, and processing times. And with that, I would like to introduce Crystal Lowry, the Clinical Customer Success Manager at Ultromics, who will dive into how Ultromics is using AI to rapidly advance cardiac care.
Thanks, Adam. What a great overview of the exciting things happening at Fuji and in cardiology in general. A little about me, I've been in Echo for 15 years and I've been at Ultromics for 3 years. And the innovation I've seen in my career, particularly with artificial intelligence, has just been incredible. The demands on sonographers are increasing. We all know that. We have more patients, we have sicker patients, and longer protocols every year. One physician I know said that Echo was becoming the 5th vital sign. And with the beautiful image quality we see in the new machines, Echo is only going to grow. So we need artificial intelligence to come in and help us to keep up with the demand on our industry. So I've heard it said before, Echo labs who use AI will replace those that don't. And we're harnessing what I like to call as the power of the pixel in our technology. There are millions of pixels in a single Echo image, and our algorithm can see beyond what the human eye can see. I wanted to point you guys toward this neat alluvial plot we have here from one of our papers that came out recently in JACC. And this was our ability to properly diagnose folks with HFpEF and put the indeterminates into the correct buckets. So we've done a few technological breakthroughs at Ultromics. We've had, obviously the AutoView classifier, which we've spoken about with Adam, and that's going to be incorporated directly into Fuji Synapse. We've developed disease classifiers from CAD to HFrEF, and this one specifically is for HFpEF, which has gone live with reimbursement codes recently. So why HFpEF? Well, HFpEF has historically been a challenge in cardiology, with up to 60% of echoes being indeterminate. And with our software, we can correctly place those indeterminates into buckets. So our algorithm measures the pixels of a single 4-chamber image and is able to detect HFpEF. heart failure itself rather is the #1 cause of hospitalizations and readmissions, and HFpEF is outpacing HFrEF to become the #1 heart failure phenotype. And the outcomes of people with HFpEF and HFrEF are the same. They're not in good shape. Every time someone's hospitalized for heart failure, it costs $14,000. That's why Medicare is willing to reimburse for this technology so that these folks can get the proper treatment that they need and to stay out of the hospital. I wanted to show you how this will work practically speaking. A lot of people hear AI and they don't know what to think. I want to tell you this is very, very easy. For Fuji customers, we're integrated right into the Fuji Synapse packs. So all of this is done in the background. There are no additional clicks for your sonographer, and physicians can even choose to send echoes through your Fuji packs to Ultromics for analysis as they read, right from the packs. So if they see a case that looks indeterminate and they wanted more information, it's very easy. And we would be able to route them back with results within 30 minutes right into their packs. So this is a clinical example of what to expect in echo. We're all familiar with these images. We have a moving 4-chamber image. We have pulse wave Doppler and tissue Doppler there. There are a number of parameters that we take as sonographers to determine diastolic function. We look at several measurements of Doppler. We do a lengthy process of structure and function, and often we still won't get conclusive information. So with our algorithm, what we'll do is just look at that single 4-chamber image at the level of the pixel, and we can detect HFpEF from that alone. And that's one way to really augment your diagnostic capability. We also really want to unblack box the AI for everyone. It is a convolutional neural network. It involves complex math based on pixel intensity numbers, but we can offer physicians a confidence score so they can augment their diagnosis with our algorithm. In a nutshell, we can tell reading physicians how confident the AI is so that they can go on to make a confident decision for their patients. Since we save health systems and payers a lot of money with confident diagnosis, we've achieved reimbursement codes. Earlier detection of heart failure will get these patients on the proper treatments and keep them out of the hospital. So the tech pays for itself. It's better for physicians, it's better for sonographers, and ultimately it's better for patients, which is why we're all in this in the first place.
Thanks, Crystal. It's exciting to see the level of automation and technology Ultromics is bringing to our market. Okay, let's open up the floor to some questions. You still have time. If you have any questions, again, you can use the Q&A button on the bottom to submit them. Crystal, it looks like the first question is for you. The question reads, is EchoGo currently available and being used? And what, if so, what are the current Ultromics users, what have they found in the use of the solution?
So we are in the market and it is being used. Our current users have seen increased throughput, ease of use. It gives their sonographers more time for their patients, and it helps cardiologists with a more accurate diagnosis. They found our program to have zero variability, to be seamless, and of course it is vendor neutral. So it's really increased diagnostic capability in the Echo Lab.
Thanks, Crystal. The next one, let's hand this one to Adam. The question reads, I have interest in Ultromics, but I also want to integrate to other AI algorithms. Is that possible with FUJIFILM?
Absolutely. So that's one of the beauties of the Synapse AI platform, is it allows us to utilize multiple different AI vendors and their algorithms on a single procedure. It's certainly something that we've worked to do so that we don't have to necessarily utilize one vendor or utilize one algorithm for your procedure. Let's take advantage of all of what's available and give you the most information we can.
Yeah, thanks. Crystal, back to you. Another one here. The question is, do we really need, this is a good one, do we really need AI for Echo? What does AI do better than a human can do for Echo? Should I really trust AI?
Yeah, that's a really great question. I think with AI is kind of a big buzzword right now with ChatGPT and everything. And I do want you to know that not all AI is created equal. What we've done is a convolutional neural network, and it's really game changing. There are things that artificial intelligence can do better than the human eye. Humans suffer from a lot of confirmation bias. We make hundreds of micro decisions every time we do an echo. We get decision fatigue. AI does not get decision fatigue. And as our echo protocols grow longer and our patient lists grow longer, we really need AI to help us keep up.
Thanks, Crystal. A lot of questions coming in. I'll try to summarize a couple of them, but it's all around how is Echo Go trained and what is done to help, I guess, against the algorithm performance strengths.
Yeah, we've got actually a ton of information on this that I would love to send to anyone with our research dossier. How it's trained in a nutshell is, so for instance, this specific disease state of HFpEF, we took thousands of known HFpEF patients from the Mayo Clinic and then thousands of non-HFpEF patients, and we fed them both through the algorithm, and we said, learn what these have in common so that you can properly sort them into buckets. And so now that the algorithm has been trained to look for the commonalities, it can take any echo, ingest it, and put it into one of two buckets. And of course, if it's really on the fence, it'll come out as inconclusive, but that's really, really rare. And then we have validated against sources outside of Mayo Clinic, right heart cath, any HFpEF, any definition of HFpEF, any HFpEF parameter, outcomes, SGLT2 inhibitors. This thing has been tried and tested.
Thanks, Crystal. Appreciate it. Just reading through the questions here real quick, making sure we're answering them all. This one, Adam, is for you. Can the data that's generated by the AI vendors such as Ultromics, can that be populated inside the clinical report?
For sure. Yeah, no, we have been able to utilize some of our features, such as like our data importer, our GPI, as well as some other methods to be able to make sure that we bring in that data and that information and are able to pre-populate a report as well with it.
Great. There's kind of a follow-up question, Adam, to that, and that's regarding, how long does it take to integrate the Echo Go solution with my current Synapse Pack setup? Can you just kind of, from a high level, provide some?
Yeah, no, good question. So it is a pretty straightforward. A lot of the nice things about, again, the open platform is we've been able to utilize a lot of the standards that are already available and folks are utilizing today. So from that perspective, we would be able to, engage our teams and be able to add on the AI platform and spin up those additional system. And then from there, just integrating with the platform itself. A lot of this is already done and pretty ready to go out of the box, and it's very easy to implement.
Yeah, thanks. Crystal, back to you. This one is around image quality. Can only great images be analyzed by the Echo Go analysis package?
So this is also why I like to harp on harnessing the power of the pixel. A lot of things the human eye cannot see, the pixels can see, or the AI can see at the pixel level. So imagine seeing every shade of gray with your human eye. That is what the AI can see. So it's able to mathematically differentiate all of the pixels. I guess long story short, we've seen some really subpar image quality get diagnosed. And so it's not as big of an issue as when you're looking at it with the human eye.
Great.
And then also I will say this too, it was trained on all sorts of image quality and all sorts of sonographers, different equipment, things like that. So there's a lot of variability between your textbook image and what you can get bedside.
Great, thanks, Crystal. One kind of follow-up question. It says, have physicians using this report reported the confidence score, or do they use the score to report their standard findings?
That's a great question. So what we say is we are a diagnostic tool for physicians, but ultimately they make the diagnosis. So it's a way to give your own diagnosis confidence if you're a physician. So they will not report the confidence score, but they can go to their diagnosis with confidence.
Great, thank you, Crystal. Adam, we got a few more here. I think this one is for you. Can you give me a high-level summary so I can communicate the benefits to my team in just a few sentences, please? What is AI really going to do for my organization?
Sure, no, good question. So really what we want to do is we're trying to help eliminate, some of the items that are being utilized in today and help streamline those. For example, I really think the view identification or as well as the automated measurements, looking to help drive, decrease, variability within those so that they can really be utilized further on for comparison, as well as, your diagnosis, and taking a lot of that, we'll call it the easier measurement away and automate that so that you can spend more time working with the patients, being able to help diagnose, especially those complex anatomy, and being able to streamline that workflow.
Thanks, Adam. I appreciate it. All right, I think we have one more here, and I'm gonna, Crystal, I'm gonna hand this one over to you. It says, per compliance, hospitals or healthcare organizations are required to store images for 7 to 10 years. If an org uses AI in decision-making to report a study, will we want to store this AI data for the same period of time? How does AI data get stored? Is it part of the DICOM data or some other technology?
So it's returned back to you as a secondary DICOM capture. I know we are ISO compliant, we are ISO certified, we're HIPAA compliant, we establish BAAs with all of our customers. So everything will be above board.
Thanks, Chris. Appreciate it. All right, I think we did it. I think those were the questions that came in today. Thanks again for everybody that took time to join us. Again, a link of this recorded presentation will be sent to you via the registered email address. This presentation will also be available inside our Synapse community. If you have any additional questions or have interest in the technology we discussed today, please reach out directly to your Synapse cardiovascular sales rep.